Sharon Pearce is a Republican from Davidson County seeking to replace Rayne Brown, the state representative who did not seek re-election. Thanks for sitting down with me for a few moments.
Absolutely, it's my pleasure.
Well, what do you bring to the table if you're elected to go to Raleigh? What do you stand for?
Well, let me give you some of my background. I am a certified registered nurse anesthetist. And I just came off of being the national president of all nurse anesthetists in the country, representing 49,000 nurse anesthetists. You know, and whenever I look around at a lot of things that are coming out of the legislature and even things that are coming out at the national level, it's about health care and what is the number one thing that Americans identify as very close to them as far as issues, and that's health care and fitness. But the people who make all of the decisions about health care aren't in health care. We currently have 2 nurses in the General Assembly in the House right now, and those are the only health care people that are there. On top of that, we only have 26 women out of 120. So I just felt like since Rayne Brown was retiring, we needed to replace that with another female and someone with a health care background going forward to help in some of the decisions.
What's okay, we'll keep, healthcare is a big issue, and don't even start on Medicaid right now.
Right, let's not. We don't have enough time.
But at the kitchen table level, what's missing from the healthcare system in North Carolina that you would argue for as a state representative with a chance to file bills and get them passed?
Well, one of the things I believe is we call it a healthcare system. It's not a healthcare system. It's a disease-based system. When you come into the healthcare system, are you healthy?
Probably not.
You're sick. So we have a disease-based system. So we need to be looking on how to make North Carolinians more healthy so they don't have to enter our system.
Medicaid reform is getting underway. Is it Medicaid broken? Does it need fixing, if you will?
Well, I do think that Medicaid is broken. You've got to remember, I also look at it from the provider side at this particular point. But it is broken, and we're going to have to do some work on Medicaid. And I think there are a lot of abuses within the system that need to be looked at. At one time, they were having difficulties even with the IT departments, and don't even get me started on electronic health records. That's kind of a sore spot with a lot of healthcare providers right now. There's a lot of work to be done, and who else should be doing it than people who live within the system?
From all my years in Raleigh, Democrats are usually the champions of healthcare policy. Republicans, of course, will say that's not true, but you know how the branding goes.
I understand.
As a Republican focused on healthcare policy, is more government better in terms of how you structure the industry, or is it more of a market-based approach? And then you hope the companies would come in and support fitness over, I guess, what you call it, sickness care.
You know, interesting that you would ask that question, because I am an advanced practice registered nurse, which means that I am not a physician. And it's been borne out in the literature that advanced practice nurses can be a solution to the healthcare problem, that we should be using them to the top of their licensure, and actually it will save the system a lot of money. I just have been in Washington, D.C. working with the VA about allowing advanced practice nurses function to their highest authority. And even using nurse anesthetists, we can save the Veterans Administration $105 million a year. Well, I know that sounds like chump change, and some people...
You can take it down to state level, you think.
Exactly. And allow everybody to function to the top of their licensure, and we can save the system lots of money. Now, you know, that sometimes has not resonated within the Republican community, and I hope as someone within that community, as a Republican, I can give voice to that.
Sharon Pearce, you're on the ballot, and you could be coming to Raleigh next fall, or next January at least.
Absolutely.
Thank you so much for sitting down with us for a few moments.
Most definitely.
Thank you.